Step 1 is to check medication order against the original physician's order according to agency policy. Clarify any inconsistency. Check the patient charge for allergy. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician order is the legal record of medication order for each agency. Step 2 is to know the action, special nursing consideration, and safe dose ranges. Purpose of administration and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient and perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effects of the medication in relation to the patient disorder and can also be used to calculate the patient about the medication. Hand hygiene deters the spread of microorganisms. Step 3. Place medication in a tray or move the medication cart outside of the patient room or prepare for administration in the medication area. Organization facilitates error, free administration, and save time. Step 4 is to transport medication to the patient bedside carefully and keep the medication inside at all times. Step 5 is to identify the patient by checking the name and identification on the patient identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Step 6 is to explain procedure to the patient to gain cooperation and to allay anxiety. Step 7 is to fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Step 8 is to turn on the air compressor to ensure the efficient preparation of the medication. Step 9 is to observe the fine spray from the nebulizer. Check that the equipment is working. Step 10 is to encourage the patient to breathe the nebulized vapor through the mouthpiece. A mask may be used if a patient has difficulty with the mouthpiece. Breathing through the mouth or normally with a mask help the medication travel to the lungs for maximum effect. Step 11 is to remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mess on exhalation from the opposite end of the mouthpiece or vent holes in the mask. Lack of mess ensures that the client has inhaled the entire dose. Step 12 is to encourage the patient to expectorate, as the medication may help to loosen the bronchial secretion. Step 13 is to ensure that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Step 14 is to wash and dry the nebulizer, tubing, and mask or mouthpiece with a warm, soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Step 15 is to retain the equipment in a polythene bag. For the patient next administration to prevent infection, the equipment should be changed every 24 hours. Step 16 is to document the nursing practice appropriately, monitor adverse effects, and report any abnormal findings to ensure safe practice and enable prompt appropriate medical and nursing intervention to be initiated.